Hello, everyone. Again, I would love to invite all of you to this today's session where we are going to have a lot of understanding about pulmonary fitness and conditioning during the pregnancy. The session is going to be taken by Dr. Devita Arora. She is the director of the Physio World. She has done MPT in cardiopulmonary rehabilitation. She has done certified pelvic rehab specialist program with Dr. Samana Sayed, and she also has done a lot of women health related workshops and a lot of learning, and she is a childbirth educator and working and helping females more than 10 years now. So we have Dr. Devita Arora, and she's presenting this important topic for all of us, and we are so glad to have her. Thank you so much, and we are expecting that we will learn something out of this today. Thank you, Dr. Devita. Shall we start our session, please?
Good evening, everyone, and a very happy Friendship Day to all my physio friends who have joined today. So, I have made this very easy, and you all will find it very helpful while you decide to help any of your pregnant client. Can I have this slide, ma'am? First slide. So, before jumping on the exercises and types of breathing part and different techniques, we are quickly going to take a brief intro about what all changes the body goes during pregnancy and also what impact it gives on our pulmonary system. That is important to know so that you can design and you can decide what all exercises you are going to give to your pregnant client. So, during pregnancy, as everyone knows, body undergoes many changes, and it is very important to understand these changes before prescribing any set of exercises to your pregnant client. So, I will be discussing briefly about the changes happening in pulmonary system before we learn the types of breathing exercises and different types of breathing techniques. These two are different things, so please make sure that you learn it properly, and if you have any doubt you can ask me at the end of the session. I will show the practical demonstration also of each and every breathing technique and also each and every breathing type we use to train our pregnant female to ease the labor process and also to assist pain-free delivery, right? Next slide, ma'am. Oh, okay. So here is the image which shows clearly that how much diaphragm descends upwards and how much circumference of entire thoracic cage is changing. It is changing because the muscles get loose because they need to give more space to the growing uterus. So the diaphragm is pushed upwards, and the to sort it, our body is very intelligent. God is being so kind that what happens is the muscles get relaxed, which are there around the entire thoracic cage, and also the transverse diameter of the thoracic cage gets increased. So in totality, we can say 5 to 7 centimeter of total circumference or thoracic cage is increasing during by like from the start until the end of pregnancy, because it has to give space to the growing uterus. Next slide, ma'am. So is this clear? This is the basic mechanics that how the body and the thoracic cage and the lung space gets adjusted during pregnancy. Right. So what are the physiological changes in our pulmonary system that happens during pregnancy? See, during pregnancy, week by week, changes occur in a female body. So, hormonal changes in pregnancy affect the upper respiratory tract, which cause airway hyperemia and edema, resulting in symptoms of rhinitis, which is very common. Estrogens are likely responsible for many of these effects because they produce capillary congestion and mucus gland hyperplasia. So now if we come to the thoracic cage, so changes to the thoracic cage result from both the enlarging uterus and the hormonal effects producing ligamentous laxity, as I explained. The diaphragm is displaced upwards by up to 4 centimeter, but the potential loss of lung capacity is partially offset by an increase in anterior posterior and in transverse diameter and by widening of subcostal angle. So this says if the diaphragm is pushed upwards also, which is the main inspiratory muscle, though what all changes are happening in the entire thoracic cage in like muscle lengthening or ligament laxity, ligament laxities, it gives space to lungs to expand as normal as it was doing before this pre-pregnancy situation. So this despite these anatomic changes, diaphragmatic function remains normal. Diaphragmatic excretion is not reduced, and the maximum transdiaphragmatic inspiratory pressure that can be generated near term are similar to values generated by patients who are not pregnant. So, this is the main reason why the values are normal. But still, we will learn that what all changes come in different volumes and capacities of lungs. The changes in the chest wall return to normal within 6 months of delivery, although the costal angle may remain widened. Right. So in the picture, you can clearly see functional effects. What is going to happen to different volumes and capacities of lung? So there is hardly any change in total lung capacity. The reason I have already explained. And but the tidal volume it increases, and there is also reduced functional residual capacity. So basically because of functional reduced capacity, what happens is, why it is reduced, because the diaphragm has been pushed upwards, and the lower area, the basis of the lung, which gives a huge area for the exchange of gases, that has been little much depressed, because of which shortness of breath occurs in most of the females and 70% of the pregnant females. So next slide please. So shortness of breath, a common symptom, it can begin in the first trimester and may get worse over time due to increased pressure from the fetus on the diaphragm and hormonal changes. See, this is one thing which is causing shortness of breath, which is mechanical. The body undergoes so many changes. But other than this, what can cause dyspnea? Anxiety can also cause shortness of breath. Change in posture can also cause shortness of breath, and a sudden a change in your routine activities can also cause shortness of breath. So as a physiotherapist, whenever you are going to assess any pregnant client for this type of training, that you are going to teach them breathing exercises, and you are going to make sure to assess their pre you're going to ask them their pre-pregnancy fitness level, and then you are going to assess at the time they have come to you that what is their inspiratory functioning and what is their expiratory functioning, in terms of like you can ask them to inhale, and just you can count on that for how many seconds the pregnant female is trying to hold the breath, and to how much time she is taking to for like when she's inspiration when she's inhaling, you need to count like till 4 she's able to inhale, till 5 she's able to inhale, and you need to mention that on the and you need to record that on the slip. Then what all factors can affect this thing is, sometimes when you see, as I told you, that posture also contributes, because the females who have stoop posture or kyphotic posture or with round shoulders or with tight chest muscles, definitely in those females I have seen that shortness of breath is more common than the females who are already working on their posture. Other thing is the routine lifestyle. So we need to tell them that their lifestyle is also going to impact their breathing patterns, their level of anxiety and stress, and also then to breathlessness, right? So what we are going to do is, after in assessment part, you need to just make sure that this is normal physiological breathlessness or something pathological is also there. So once you will once you will evaluate that, your programming to train the muscles becomes easier. Then coming back here again, as I told, this shortness of breath, whatever changes are there in the thoracic cage, if they will get reversed post delivery, so automatically shortness of breath will also get reversed post delivery. There is significant increase in oxygen demand during normal pregnancy. This is due to 15% increase in metabolic rate and a 20% increase of increased consumption of oxygen. Also, there is 40 to 50% increase in minute ventilation, mostly due to an increased tidal volume rather than in the respiratory rate. So, what happens is, what all changes the body is automatically doing as being gifted by God, there is no change in the respiratory rate. This shortness of breath only comes when there is sudden increase in the demand of oxygen consumption. Right. Next slide, ma'am. So in this slide, you can easily see progesterone as an hormone also plays a very important role as it gradually increases, week by week. So what it is going to do is it will increase oxygen consumption, it will increase arterial partial pressure of oxygen, and also reduce the arterial partial pressure of carbon dioxide. So because of which what happen is minute ventilation get increases. So a pregnant female tends to breathe frequently, right? So that is the role being played by the hormone progesterone. Now when uterus is going to get enlarged week by week, what is going to happen is resting position of the diaphragm will get changed, the abdomen dimensions will increase, rib cage dimensions will increase, which will further help to compensate, right? So next slide, ma'am, please. So automatically, so few many of the structures of the body inside are going to sort the problem of shortness of breath. And what usually happens, a female complains shortness of breath when she is near or in third trimester, right? So now what we need to do for her in that case, let's discuss. Before that, let me just explain quickly what are the benefits of breathing exercises in pregnancy. See, in routine life also everybody knows that breathing exercises are very much important. Okay, so why it is important now these days? To calm, to relax, just to reduce the stress and anxiety. Okay, and then breathing exercises we also advise to patients who have sleep disturbances. So few things are very much normal, but in pregnancy the importance really gets increased because the mother is very much you can say she is already undergoing so many changes, physiological changes in her body, and she is also preparing herself to cope up with the external environment. So automatically her stress and anxiety is going to get increased. So we need to explain them that these benefits of breathing exercises are there and they must practice it, which ultimately will help them prepare their body for normal delivery and to go easily through the process of labor. Other benefits of breathing exercises are they help regulate blood pressure, which is again a very important thing to parameter in pregnancy, which has to be regulated. Then it also improves circulation and digestion. And anything when we practice breathing exercise, there is increase in the oxygen level in the blood now, so every organ of the body will function better. So also easy fatigability is again a common symptom in pregnancy, so breathing exercise also help increase energy level. Additionally, breathing, when the pregnant female starts practicing breathing exercises, it helps her to get connect with her baby, providing a deeper level of communication and bonding. May I have the next slide, ma'am? Thank you, ma'am. So now let's come to breathing techniques. This is very important part which you need to learn, and then we will learn it one by one, and then I am going to tell you that in which situation which form of breathing exercise will give result. So simply starting deep breathing exercise. What is deep breathing exercise? Itself, it says that one has to focus on taking deep breaths. Inhalation period also we need to increase, and exhalation period we also need to increase. And now, how we can relax our mind and body with deep breathing exercise? We need to sit in a good posture, very in a calm space, which is not full of distractions, which should be free of distractions. That is very important. So when you take deep breath, you take to inhale large amount of air and try hold it for few seconds. So what we tell is that for a pregnant female, when she is trying to inhale, so like I'm inhaling, and what I'll tell is start counting and back of your mind up to 6. So when the pregnant female will start counting, she will start focusing on her breath, and that will help her to reduce the stress and reduce the anxiety also, and also make her muscles release and relax. So to do deep breathing, start by if you are doing it in standing position, you should be standing in a very relaxed position with your feet and shoulder wide apart, and also your hands on hips. Then start taking deep breaths. So one thing which you need to tell, which you need to command and teach your client is that there are two commands. One is we will tell you inhale through nose and exhale through nose. And the second one is inhale through nose and exhale through mouth. So in deep breathing, you are going to give command to the client that they have to inhale through nose slowly, and then once they are done with the inhalation, they should not be rushing or they should not be in hurry. They should be doing it very slowly and calmly, and then slowly exhaling the air till they feel that their lungs are totally empty. Like that you have to give them command and make them repeat this breathing pattern 10 times. But one thing which happens is sometimes the pregnant client starts feeling lightheadedness or also dizzy. That time you have to tell them before starting only that if something happens to you like this, immediately inform us and stop. We are going to stop the process. We will give you rest and again we will start that, right? Then the second breathing technique comes as belly breathing, also known as abdominal breathing. So in this technique of breathing, we try to guide that you have to fill air in your tummy, right? So this is one of the best ways to oxygenate your blood and reduce stress during pregnancy. It is also an excellent way to prepare your body for childbirth. To belly breathe, place your hands on your belly and inhale deeply through your nose. As you exhale, imagine your belly button moves backward towards your spine. Repeat this process 10 times, and for as long as you feel comfortable. As I told you that if the pregnant female, if you started feeling anything like of dizziness or heavy lightheadedness or headache, you have to immediately stop it. Next slide, ma'am. Then comes the lateral costal breathing. Now this breathing pattern is helpful in the lateral expansion of lungs, right? So this is a chest breathing technique is one in which you need to put one hand over your chest and the other hand over the costal angles, or you can also place both the hands on both the costal angles to feel maximum expansion over the area which is the lateral area of the lungs, which is the below the axillary line. Through that axillary line, the hand should be placed over there. There, the costal angles are present. And then you need to give the command inhale through nose till you feel that that area is expanding. So once the uh, pregnant female starts feeling that yes, there is some movement of her hand outward, so after that, they need to exhale through mouth. So this is the lateral costal breathing. So what we have learned till is the basic deep breathing. That you always need to start with that only. One should not hyperventilate also the client immediately. So first the deep breathing, then comes the belly pump breathing or this abdominal breathing, then comes the lateral costal breathing, right? So last thing is the visualization. This is very helpful, and I have been practicing this thing with my pregnant clients, and the results are amazing. So what happens during visualization is these are the set of exercises that can be a great way to prepare for pregnancy and childbirth. By picturing yourself going through the various stages of pregnancy and childbirth, you can help to train your mind and body for the experience. Start by finding a comfortable place to sit or lie down. Close your eyes and take a few deep breaths. Picture yourself feeling strong and healthy as your baby grows inside of you. Spend a few minutes each day visualizing yourself pregnant and giving birth, and you will be surprised at how much it can help to calm your nerves, and ease your anxiety. So, in this technique, you have to, help your pregnant clients in visualizing that they are healthy, they are strong, they can go through the normal delivery process, all these things. And you also make sure that you are guiding them by showing videos of childbirth or by showing videos of a growing baby inside the uterus in a very positive way, because most of them are very much worried and stressed that no, 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 we can't see this, we can't go through this like that, right? So these were the breathing techniques. Now we'll come to the types of breathing. mm. Ma'am, I need to switch on my video as well. Am I visible?
Yes, ma'am.
Okay. So, types of breathing. I'll give you an overview by showing you that how different types of breathing which we are going to teach to our pregnant clients, that how they work, right? So first breathing is in simple way. I will teach you. First breathing is, if we call it shallow breathing. So how you are going to train for shallow breathing is that just